Preparing your tooth for a filling or restoration, especially for deep cavities, requires a comprehensive home care regimen. It is especially important when the cavity is close to the pulp, and the goal is to conservatively treat the tooth to maintain the vitality of the living pulp. Here's a 4-part regimen to get your teeth ready for these restorations. Firstly, nourish and strengthen your teeth from the outside in through remineralization. Start with the right toothpaste, like Risewell or Boca, containing nanohydroxyapatite, which is a key component of teeth that aids mineralization. Using spry rinse raises the pH of the mouth, making it less acidic, and also reduces cavity-causing bacteria because they can't use xylitol, they need sugar. Spry also stimulates saliva flow for natural remineralization. David's expanding dental floss coated with nanohydroxyapatite helps reach between teeth for enhanced mineralization in those hard-to-reach surfaces. For enhanced nighttime remineralization, alternate between BioRepair Nighttime Advanced and Dentite every other night before bed to get the unique benefits of both. Secondly, nourish and strengthen your teeth from the inside out through the blood supply that goes to the dental pulp. The dental pulp contains odontoblast cells, which help reinforce the dentin, which is the layer right below the enamel, and strengthen the tooth internally. Vitamin K2 is essential for proper nutrition of odontoblasts, which release osteocalcin, a glycoprotein aiding in calcium transport to teeth and bones. Alongside a healthy diet, vitamin K2 supplementation gives odontoblasts a real boost to reinforce the tooth. Minimizing sugars and refined carbohydrates is crucial to prevent mouth acidity. Bacteria metabolize sugars and turn it into acid, which causes cavities. The third step involves using low-level laser therapy on the teeth. This therapy reduces inflammation and stimulates reparative cells, aiding the healing process. Low-level laser stimulates the production of ATP, or adenosine triphosphate, which is the energy odontoblast cells need to do their job. Point the curved tip of the low-level laser at the tooth for about 2 minutes, twice a day, starting before and continuing after the dental work for optimal results. Lastly, oil pull with an ozonated oil like Puro 3. This reduces bad bacteria and keeps gums healthy and inflammation-free, crucial for a clean site when the tooth is being restored. Bleeding while the composite restoration is being done can contaminate the site and adversely affect the quality of the bond to the tooth. ProDentim oral probiotics can also replenish favorable mouth bacteria, which are important for overall oral health. It's essential to note that this protocol complements daily plaque and biofilm removal with brushing and flossing and is not a substitute for it. When the tooth is treated, the dentist should carefully remove the cavity, keeping the tooth totally isolated. The remaining tooth structure should be disinfected with ozonated water and gas, and low-level laser at this point gives added protection to the pulp. A calcium liner, such as Theracal, should be placed at the deepest areas for a protective seal. The bonded composite restoration should be done in small increments to control the shrinkage and to get the best bond possible. I've had great success with this protocol, and I've helped patients avoid infected teeth and the difficult treatment decisions that brings. This at-home regimen will strengthen and fortify your tooth, and the careful, conservative treatment by the dentist will help ensure that the tooth stays healthy after the dental procedure is done. The at-home protocol also empowers you to take control of your oral health, even if your teeth don't need restorations. The ultimate goal is to eliminate the need for invasive dental procedures, and with optimally healthy teeth and gums, the risk and prognosis of any necessary procedures are significantly improved. All these products can be found on www.holisticdentallearning.com in the appropriate tabs. You can also find an info sheet on this protocol in number 8 entitled Healthy Pulp in the info sheet table of contents.